Acute esophageal necrosis. Definition is a real clinical entity arising from a combination of ischemic results seen in hemodynamic compromise and low flow states corrosive injury from gastric contracts in the setting of the esophagus, gastrophoresis, and gastric outlet obstruction, and decrease the function of mucosal barrier systems.
The esophagus is a tube that carries food from the mouth to the stomach. Where it connects to the stomach is a muscular ring called the lower esophageal sphincter, or LES. The LES opens to allow food and drink to pass from the esophagus to the stomach, and usually remains closed to prevent stomach acid from going up into the esophagus. The LES opens at inappropriate times in patients with acid reflux disease, allowing harsh stomach acid to back up into the esophagus, causing heartburn or other acid reflux symptoms, which may cause damage to the esophagus. If you suffer from frequent and persistent heartburn, visit your doctor and see what medicines and lifestyle changes can help maintain a healthy esophagus.
Applications in medicine. Currently, there is not direct treatment for AEN. Only treatment is for the underlying main diseases or condition. Appropriate hydration is set. Antacids are also added for further recovery support. Common support drugs of antacids are either H2 receptor antagonists and or proton pump inhibitor.
Gastroesophageal reflux disease, or GERD, is a condition where the contents of the stomach come back into the esophagus, the tube that carries food from your mouth to your stomach. It is also called acid reflux. In normal digestion, the food is chewed, swallowed, and pushed down the esophagus for further digestion. The lower esophageal sphincter, LES, at the end of esophagus opens to allow the swallowed food to pass into the stomach. It closes tightly to prevent the food and acidic stomach juices from flowing back into the esophagus. Gastroesophageal reflux occurs when the LES is weak and allows the stomach's contents to flow up into the esophagus. Many people, including pregnant women, suffer from heartburn or acid indigestion caused by GERD, or a condition called hiatal hernia. In most cases, GERD can be relieved through diet and lifestyle changes. However, some people may require medication or surgery. Factors that may cause GERD. Dietary factors: shorter dinner to bedtime, high-fat diet, obesity, and smoking. Lifestyle-associated factors: stress, major life events and alcoholic events, and family history. Following are the most common symptoms for people with GERD. Heartburn. Typically, heartburn related to GERD is seen more commonly after a meal. Regurgitation. Regurgitation can produce a sour or bitter taste, and you may experience a wet burp or even vomit some contents of your stomach. Stomach pain. Abdominal bloating, acidity, excessive burping, nausea, trouble swallowing. Asthma. Refluxed acid can worsen asthma by irritating the airways, and asthma and the medications used to treat it can make GERD worse. Sore throat. If acid reflux gets past the upper esophageal sphincter, it can enter the throat, pharynx, and even the voice box, larynx, causing sore throat. Excessive night cough, excessive dry cough. Chronic dry cough, especially at night. GERD is a common cause of unexplained coughing. It is not clear how cough is caused or aggravated by GERD. Sudden increase of saliva and bad breath and ear aches.
Pros and cons. Cons. Notable symptoms may include epigastric abdominal pain, vomiting, dysphagia, fever, nausea, and syncope. Complications include perforation with mediastinal infection abscess. Pros. Unlike the rest of the gastrointestinal tract, the esophagus lacks serosa and is separate from the adjacent organ by few millimeters for connective tissue. An important factor is potential development of extrinsic necrotic injury to the organ and spread of the infection processes.
Inflammation might play a significant role in the progression from GERD to esophageal cancer, according to a study in clinical gastroenterology and hepatology. Lead author of the study, Rune Eriksson, claims, "Our research shows that damage to the esophageal lining that can be seen with endoscopy is important to the progression from normal cells to cancer, and Barrett's esophagus is likely to be an intermediate step." In the prior 3 decades, the number of esophageal cancer cases has risen dramatically in both the U.S. and Europe. There are estimates that nearly 10,000 new cases will be diagnosed each year in the U.S. Additionally, the risk of mortality associated with the disease is still significant. Gastroesophageal reflux disease, or GERD, is widely known to be a key risk factor for esophageal cancer. However, the specific role of inflammation in the lining of the esophagus from GERD is much less clear. For this study, researchers used data from population-based Danish medical registries of nearly 34,000 patients with reflux disease. They discovered that over 26,000 of the patients had erosive reflux disease, and 37 subsequently developed esophageal cancer after an average follow-up period of 7.4 years. It was found that the incidence of cancer among patients with erosive reflux disease was substantially greater than that expected for the general population. However, of the 7,600 patients with non-erosive reflux disease, only 1 was diagnosed with esophageal cancer after 4.5 years of follow-up care.
Issue applique in Ecuador. 2 large autopsy series from the United States and France have reported 0 cases in a series of 1,000 adult autopsies and 0.2% and 3,000 autopsies, respectively. A 1-year prospective study of EHD finding in 3,900 patients has identified 8 cases of AEN.
Gastroesophageal reflux disease, GERD or gastric reflux disease, is a chronic condition where stomach acid flows back up and damages the mucosa of the food pipe, the esophagus. At the junction between the esophagus and the stomach is the lower esophageal sphincter, the LES. The LES is a ring of muscle that is generally closed tight to prevent stomach acid from coming up. In normal digestion, the LES only opens briefly with each swallow to allow the food bolus to pass down into the stomach. GERD occurs when the LES is abnormally relaxed and cannot close properly. Heartburn is a burning sensation in the chest associated with each regurgitation of gastric acid and is the most prominent symptom of GERD. Hiatus hernia is believed to be another cause of GERD. Hiatus hernia is a condition where the top portion of the stomach is pulled up, forming a herniation above the diaphragm. This situation somehow compromises the barrier between the esophagus and the stomach, facilitating acid reflux. If left untreated, GERD can lead to a number of complications, including esophageal stricture, narrowing of the esophagus as scar tissue builds up from the reflux damage. The resulting narrowed food pathway may cause difficulty swallowing. Esophageal ulcer, open sore as a result of acid erosion. An ulcer may bleed, cause pain, and again make swallowing difficult. Barrett's esophagus, precancerous changes to the esophagus. These changes are associated with an increased risk of esophageal cancer. GERD can be treated with dieting, lifestyle changes, and medication. Patients are advised to maintain a healthy weight, avoid alcohol, tobacco, and foods or drinks that trigger heartburn. Wait at least 3 to 4 hours after eating before going to bed, and sleep with an elevated head position. Drugs of choice include proton pump inhibitors, which act to reduce gastric acid production. If these fail, a surgery may be recommended. In a procedure called a fundoplication, the top portion of the stomach is wrapped around the lower esophagus and sewn into place. With this configuration, the muscles in the wall of the stomach reinforce the closure of the esophagus. This surgical procedure is particularly recommended when hiatus hernia is present, as this can be fixed at the same time.
Conclusion. AN is a rare syndrome that arises in the characteristic clinical setting of combined ischemia from hemodynamic compromise, gastric outlet obstruction with backflow chemical injury, and inadequate protective barriers of physiological reserve due to critical illness and general deconditioning.
The esophagus is the tube that carries food, liquids and saliva from your mouth to the stomach. You may not be aware of your esophagus until you swallow something too large, too hot, or too cold. You may also become aware of it when something is wrong.
The most common problem with the esophagus is gastroesophageal reflux disease, GERD. It happens when a band of muscle at the end of your esophagus does not close properly. This allows stomach contents to leak back, or reflux, into the esophagus and irritate it. Over time, GERD can cause damage to the esophagus. Other problems include heartburn and cancer. Treatment depends on the problem. Some get better with over-the-counter medicines or changes in diet. Others may need prescription medicines or surgery.